show.
All right, everybody. Thank you so much for tuning in to Single Lady Chronicles. Single Lady Chronicles. Thank you so much for tuning in this week to Single Lady Chronicles. We are talking surviving, thriving, and protecting your health. I am here with this amazing young lady. Her name is Amani Sampson. She is a fourth-year med student at the Rutgers, New Jersey Medical School, right here in the city of Newark.
Yes.
Yeah, she's from Los Angeles, California, and came all the way to Newark, okay, to get her med school education. And I'm so excited that you are here today.
Thank you. I'm so excited to be here.
Yay! Thank you. So, I told you, this week was the 1-year anniversary of my cancer survivorship.
Yes, congratulations.
I mean, I did not think that I would be saying those words, that I'm a cancer survivor. You know, you grow up, you go through your 20s, you go through your 30s, you get to your 40s, and you're like, what? I got cancer? You know?
Yes.
So I wanted to dedicate this show to having a conversation about survivorship.
Yes,
but
definitely.
also thriving and making sure that you protect your health.
Yes.
Yeah.
It's so critically important.
Yes. And so let me just give you a little background of my story.
Yes.
For a long time, I was one of those ones who didn't go to the doctor on a regular basis.
Okay.
You know? It wasn't until I got a pulmonary embolism that I had no idea what it was.
Yeah.
First off, I didn't know what it was.
Yeah, a lot of people do not know.
Yeah, right.
It's not one of those common things.
Exactly. And so when I got the pulmonary embolism, I had been walking around. I had been walking around with shortness of breath and didn't know that I had shortness of breath. I was in a play. I was in a play and I was a little heavier. I may have been either almost 300 pounds or a little over 300 pounds. And I was a little heavier. So I was in a play and it was singing and dancing. And so I just attributed it to the fact that I'm tired, I'm big, I'm just tired. And so I never thought it was shortness of breath. And I never thought it was a symptom. And so long story short, I went to the hospital. She says, oh my goodness, you have a pulmonary embolism. I was like, what's that?
Exactly.
Yeah.
Exactly.
I said, what's that? And she was like, oh, it's a blood clot in your lungs. I said, is that bad? And she says, yes, one more day and you would have been gone. I was like, wow. So folks, I'm 3 times over a living, breathing, walking, talking, moving miracle. Because I had a pulmonary embolism twice.
Wow.
Yeah. So I'm not supposed to be here. But then, so after I had pulmonary embolism, I started going to my doctor's appointments on a regular basis. I started making sure I follow up on everything. And so 2024, I got up my regular pap smear. Yes, I said pap smear. Yes,
it's so important.
It's so important. I got my regular pap smear and my doctor said, your pap smear is abnormal. Okay. So talk to me about what it means when someone says something's abnormal.
I think, a lot of times when a physician, says something is abnormal, it's really, we want to see you again. Like, we need you to come back. We need to do the follow-up testing. We need to follow kind of the algorithm to see what it is and, how we can also assist in kind of taking you back to the norm. And it's, an abnormal result is always something that you want to follow up on. You never want to ignore, and you want to kind of, go back in. Even though it's a scary time for a lot of people, I think it's much better to go in.
Right. So bottom line, don't ignore abnormalities.
Yes.
I had a friend who actually said, oh, my stuff is always abnormal. I'm like, what? Huh? Thank God I followed up, right? I followed up on my abnormality. And so, we'll get into that in a second. But please, if a doctor says that an annual something that you need to do, like a pap smear or what else? What else is an annual something?
Well, depending on your age, there are a lot of important screening tests. I think definitely like colonoscopies, especially in the Black community, we're seeing a lot of colon cancer at younger ages. So that's definitely something to follow up on. It's also about knowing a lot of women who have breast cancer in their family. If you have someone in your family who has had breast cancer, you are probably eligible to start screening at younger ages than the general population.
Right.
So that's why it's important, I think, also, and we'll talk about this later, to have someone who like knows you and knows your family and kind of your history, because like everyone's screening tests are going to be different in the things they need.
Right. So follow up on all of your abnormalities.
Yes.
So, after I got an abnormal pap smear, my doctor came in, she sat me down. She was like, okay, your pap smear is abnormal. You need a biopsy. I was like, what, girl? My shout out to Dr. Peace. She is a sister up in Clifton, OBGYN. Thank God for her. She said, you have to get a biopsy. So I was like, okay, cool. Actually, let's do timelines. So April was the pap smear. July is when the pap smear results came in, and I found out that it was abnormal. And so then in August is when she sent me to get the biopsy. Got the biopsy. Now, in the instance that someone says, oh, you need a biopsy, do you get a second opinion? Should you get the biopsy? What say you?
I think definitely, once again, this is all about like having trust with your provider. I think there's never a risk of getting a biopsy, because usually when we want a biopsy, we want more information.
Hello.
And so that
Stop right there. When they want a biopsy, they want more information. Because what they saw on the original test was inconclusive by the abnormal test. And so that means they need more information. Keep going.
Yes, so definitely I think it's like one of those things where, more information is never going to hurt you. And we wouldn't recommend a biopsy if we thought that it was going to lead you down the wrong path.
Yep. So abnormal pap smear, you need a biopsy. I get the biopsy. Biopsy results come in maybe a week later, right? Because this is kind of urgent. And my doc says, all right, Renatha, come on in. And I'm like, oh, Lord, they want me to come in. When they want you to come in and they can't tell you nothing over the phone, it's, something serious. So when I went in, she said, Renatha, you have a condition called endometrial hyperplasia. I'm like, girl, what's that? She tells me I have endometrial hyperplasia, which means that it's basically a precancerous condition. And it's a precancerous condition, meaning you have a 40% chance of actually having cancer. And my two options were have a full hysterectomy, a partial hysterectomy, or get hormones, right? And doc, tell people why I can't get hormones.
Yeah, so definitely when people have a history of pulmonary embolisms, we are less likely to prescribe things like estrogen specifically.
Right.
Yeah.
So I couldn't do the hormones because I'm prone to blood clots. So my only other option was to get a partial hysterectomy. Now, in the Black community, Black women community, in history, there's always a conversation about doctors always wanting to cut out, Black women's parts. Now, my doctor is a Black woman, and so of course, I trusted her. But I kept getting, I was telling most people, hey, I got this condition. And a lot of folks kept saying, get a second opinion, right? And so what do you say about getting a second opinion, or given like what I had going on, what say you?
I mean, I think definitely one of the things, the way we work with second opinions is I think that like, if it's coming from you and you want to get more information, once again, like a second opinion is more information. I think there's never going to be a doctor who's like, it's a red flag to say, no, I'm the authority, don't listen to anyone else.
Right.
That's definitely a red flag. And I do think like it's really important. This is why it's important to have physicians that like look like us and can talk to the history. There is a history of, you know, surgeries, especially for Black women, especially with hysterectomies. There's like a very known legacy of that. And so I think it's important for physicians who cannot acknowledge the history are also, that's not great either. You know what I mean? Like, we know the reality.
Right.
And so I think it's really important to have someone you trust and you can kind of like talk through all your options.
Yeah. And, you know, I had I trusted Dr. Peace. I had a good doctor in her, have a good doctor in her. And, you know, as far as I'm concerned, so long story short, I didn't get a second opinion. You know, I trusted her in that she's a Black woman. Like, why would she want to do this to me if it wasn't necessary, you know? And so then, of course, she's not a surgeon. She's not an oncologist. And so she referred me to another Black woman oncologist, doctor who could look at my charts, look at the biopsy, and then tell me what the next steps are. And so went to Dr. Nana Shavo. Shout out to Dr. Nana Shavo. She's a gynecologist, oncologist. And she basically told me the same thing, that it was her best opinion that I get the hysterectomy, that I get the partial hysterectomy. And so I did. Got the hysterectomy January 27th, 2025. And while I was open on the table, she found cancer. And so then I had to get a total hysterectomy. And I tell my story and I say all this to say, literally, follow up, right? Follow up. There are so many people who, you know, get these tests, they get these things and you know, they do their annuals and they, you know, they do their mammograms and they do their pap smears, but they don't follow up. Again, what is the importance of following up?
You know, I think it's like following up is where you can figure out like your next steps and kind of like, it's almost like, you know, we take our cars to get oil changes.
Yeah, come on, you take your car, right?
So you know, this is the body you have for life.
Yeah. Well, so I know you're just not just hello, okay?
Yeah.
Yes, and I failed to mention that her discipline is general surgery. So we have a surgeon on our hands, everybody. A budding surgeon on our hands.
Yes.
And so just getting back to the question, what happens? Like, what are some of the things that can happen when patients skip the follow-ups?
I mean, definitely, I think one of the biggest things, and we see it a lot here in Newark, is that when people miss follow-up, feel like they can present with advanced stages of whatever disease that was not caught. You know, I think my heart-wrenching thing is always when like someone comes in with like a colon cancer, that's my area, for example, and you know, we look back in their chart and like they got their colonoscopy at the right time, you know, and they had something abnormal polyp, but then it's like you see all the missed calls from the clinic to the patient and you're like, you know, and then the person comes back and at a much more advanced stage, or like there's a lot of women with breast issues, like, you know, I didn't notice it, and you know, all these things are, I thought. The worst for me is like a lot of people will say like, I thought it was a rash. I thought there was, a lot of people don't know, but some breast cancers can present as like skin changes around the breast. And they think that like, oh, I hit it up against something, something happened, you know what I mean? And kind of like not present, not knowing that like typically the breast cancers that show up like that are very aggressive in advance.
You know, just bringing it back to when, after I had my pulmonary embolism, I'm telling you, I don't want to say every little thing, but when anything I noticed change in my skin, or, you know, any slight little headache, or I don't know, like a bump or something on my leg. The other one that I ignored for my pulmonary embolism was the swelling in my leg. I I ignored it, you know? And I had the swelling in my leg way before I had the pulmonary embolism. And so what say you to when people, or not necessarily when people ignore symptoms, but how can someone like basically just notice what's going on without being a hypochondriac?
I think it's just kind of like about like, you know, having a good relationship with yourself and kind of like really being like, you know, I think it starts having a primary care provider is like crucially important.
Yes.
I think having someone who can kind of take more time on your visits, who really knows you and can kind of say like, okay, you're getting to this age, it's time for the screening test. And like, maybe you don't think about a symptom until you go in and someone's asking you like, okay, let's talk about what have you been experiencing for the last few weeks? Have your legs been swollen the last few weeks? You may need that kind of prompting.
Yeah.
And that's why I think definitely primary care, you know, they are the brick house of medicine.
Yeah. So let's talk about that for a second. Having a primary care doctor. I know so many people who don't have a primary care doctor. And so many people, when something happens, straight to the ER. And using the ER as primary care or using urgent care as primary care. Yep.
Yeah, I think definitely like, I mean, and there are sometimes obviously, you know, if you're like actively bleeding, you know, if they're 10 out of 10 pain, worst headache you've ever had, there are some things like you should always go to the emergency room. But I think for a majority of the time, I think if something could wait like a day or like you're like, I don't know, I'm feeling kind of, that is a good opportunity to try to get a primary care visit. Now, if you cannot get a primary care visit, which I know is also, you know, difficult for people, especially if you have Medicaid. You know, sometimes people come to the ER because like it does get you hooked up with care initially. But the thing is like, know that this is the safety net and not the like regular grocery store that you go to all the time, you know? It's like the last resort. There's also like websites like ZocDoc is one of the websites where you can find primary care. One thing you can always do that I think a lot of insurance, definitely private insurance have, and I think Medicaid is also working on this, is like virtual urgent care visits. And that's really nice because you can talk to a doctor and you can talk to a provider who can tell you like, okay, what you're saying sounds really concerning. Let's escalate your level of care.
Right. And I think, especially in an urban area, cost is a factor, right? Fear is a factor, and over-doctoring is a factor, right? And by over-doctoring, I mean, they only give me this so they can bill me for it. You know what I'm saying? Or I don't need that. You know what I mean? And that kind of thing. Let's talk about how advocating for yourself, just because, you know, so, and that's another thing, right? People think that when they go to a doctor, it's like, you know, whatever the doctor says goes. No, it's you and the doctor. It's you and the doctor. You have a say in what's going on in your medical care. Now, I'm not saying get on Google, get on ChatGPT and figure it out yourself. Because, you know, I always say I'm a bootleg doctor, which I am. Amani's like, sis, I'm in school. You are not a bootleg doctor. She's like, sis, I am soon to be Dr. Amani. Okay, do not say that you're a bootleg doctor. But anyway, and so advocating for yourself in cooperation with your doctor.
Yeah, I think definitely the model that we learn and are taught, and definitely that I think works the best, is like shared decision making. And I think shared decision making requires that, like, you know, you're bringing the things that you know the most about, which is like, you are always going to be the authority on your symptoms. You are going to be the authority on your body.
Right.
You're going to be the authority of knowing when something is wrong. And I think where the physician comes in is knowing, what do we do with this information? What are the next steps? Like, how does a treatment fit with your life goals? How does a treatment fit with the direction you want to go. Like, how can we make decisions about whatever issue you're having? And that requires kind of like both people kind of like coming in, because it's also difficult, like for us, like when we're trying to talk to someone who has a chronic condition and say it's something we need to manage over time, that person having no idea what's going on is also not helpful. You know what I mean? Because if you're going home, it's easy to like mix up medications or not know, like, why am I taking this medication? I think if you're taking any prescription medications, you should know why you're taking all the prescription medications.
Well, this is what they gave me. Why don't you know?
You know what I mean? And kind of like being able, that helps you be able to advocate for yourself.
Right. What are some of the best ways someone can prepare to go to a doctor's visit on a regular basis? Like, have a notebook, know your meds. Like, what are some of the things on a list that folks should do to prepare for? And what kind of questions should they be asking for afterwards?
Definitely. So I think it starts with kind of like I said, being the authority on your own body. And I think like having a sense of like, okay, I've been having pain here, or like having kind of a list of things you want to address in the visit. And also understanding one of the things with primary care, because the visits are so short. I know a lot of people are like, they're 15 minutes. They are 15 minutes. And the thing is like, we may not be able to address everything at this one visit. So the more you can have stuff written down and be like, okay, this is how important, knowing kind of going in, this is what's most important for me. This, maybe is on the back burner. Maybe I want to make another visit just to talk about this one issue. You know what I mean? And also kind of like understanding, a lot of people, primary care, some primary care providers do OB/GYN care and some do not. So like, especially for women, having an OB/GYN as well as a primary care provider, I think is really helpful.
And also, I feel like, if something has been ongoing, like noting frequency, and like how it made you feel, the scale of 1 to 10, how bad is the pain? So like being that kind of prepared for your doctor's visit so that it is efficient and that it works for you and that you're not leaving feeling like, well, what'd I go there for?
Exactly.
All right. Okay. I want NP? No. PA? No. She says, no, girl. I'm in school. Okay, stop it. Amani. Oh, thank you all for tuning in to Single Lady Chronicles. I'm here with Amani Sampson, 4th year med student at Rutgers, New Jersey Medical School. She is on track to be a general surgeon, graduating in 4 months. Soon to be Dr. Amani Sampson. Clap it up for her. Clap it up for her.
Thank you.
Right here in the city of Newark, all the way from Los Angeles, California. Thank you so much for being here.
Thank you so much for having me.
Yeah, I just wanted to have this poignant and this needed conversation about health and wellness and making sure that we stay on top of what we need so that we can live a long life. Just a few more questions about prevention. Why is prevention and routine care so important?
I think it's hard to see, but I think like going to the doctor when you don't want to or you feel well is how you stay well.
Right.
And that's the goal, is to stay well as you can, to stay healthy. And I think preventative care, we don't really, it gets a lot of slack in our system, but definitely like these are the ways in which you protect yourself for the things down the line. You get the screening tests on time so you catch something.
Yeah. Cool. And preventative care could be, all the things, right? Like for me, I wish I could get a PET scan once a year, but PET scans are so, I know.
No, I'm going to put a no.
Then go.
I'm going to say a no.
Okay.
No,
all right.
No.
Enlighten us.
No.
So let me tell you, hold on 2 seconds.
Yeah.
So when I found out I had cancer, I was like, shoot, I want to PET scan my whole body now, right? So tell me why I shouldn't. Go.
Okay, so definitely like, and this is where I think like the shared decision making makes is really
let me just also, and I'm sorry for interrupting, a PET scan is what?
So a PET scan is like a full body scan typically that we have for patients who were concerned about malignancy and it's spread to other places. It's usually typically the way that it's done in most like places all the time, is that, you know, you have a tissue diagnosis of a particular cancer, and then they're kind of doing the PET scan, anticipating that there are going to be areas where there could be spread.
Okay.
Now, that is not the only way that we assess for cancer spread out there.
Right.
There are many other exams.
Biopsy.
There are biopsies. We also do like CT scans. There are MRIs. Like there are lots of different modalities based on wherever cancer in the body. Now, I've seen a lot of like direct to consumer marketing around different scans you can get. And one of the dangers with these scans is that a lot of things are benign.
Yeah,
that could be abnormal.
Because it could be a bump or a lump, and a lot of things. And just because there's a bump or a lump doesn't mean it's malignant.
Yeah,
it could be benign.
Exactly. And so, like, we really reserve some of these tests really for when we're like, we really have a true concern. But definitely, I think, you know, it's interesting because, you know, we have all this technology. We're like so excited about it, and it's great. And I think definitely we have people, when you have something scary happen and you're like, oh, it could happen again. And really, it's about, once again, you are the authority on your body.
Right.
You know what I mean? And like, your body is going to tell you a lot of times when something is wrong. And it's like, how can you help people like get quiet and like start really listening to themselves of being like, okay, like, why is my appetite the way it is? You know what I mean? Like, why am I not sleeping?
Paying attention to small things.
You know
like
what I mean?
that.
Because those are going to be the signs that when something is really wrong. And I completely understand the like desire to be like, oh, there's a test that exists.
Right.
I want it. But it's also like the risk. Sometimes the risk of like over testing, like you were saying, that's where we kind of get into this, you know, environment where we're chasing things that aren't in reality,
right,
and aren't related to like the symptoms,
right. So thank you for that, because I literally was going to ask again. I was going to ask my OB again. It's like, girl, listen, let me get this PET scan, because in my situation, it was precancerous, meaning we didn't know if she has cancer or not. So I literally had to have surgery to find out that I had cancer. And so in my mind, I was like, oh, I need a PET scan, you know? Yeah. But to your point, you know, it's only in cases, of malignancy, and so and thank God I don't have any malignancy. I was cut it out. My surgery was cut out the cancer, no treatment. No treatment. I was stage 1A endometrial uterine cancer. And so, girl, you're awesome. Thank you so much.
Thank you for having me.
Yes. So the bottom line is just find you a primary care.
Yes.
Right? Do your regular checkups.
Yes, always.
And do your regular checkups on all the parts. Right?
Yes.
On all the parts. Even doctors you haven't been to before, you know, go to your podiatrist, go to your ortho, go to, you know, your gyno, go to your prostate guy, go to all the, you know, all the things, your boob doc, you know, get your mammogram, get those things on a regular basis.
Definitely.
Don't ignore abnormalities when you do get your tests. And always make sure you follow up.
Yes.
Yeah.
Just check in.
Just check in. Oh my goodness. It's just so important because, you know, a lot of folks in our community do things out of fear, do things out of the cost, and do things out of, you know, like, some even say it was a waste of my time, you know? And, you know, if you want to live, you got to go to the doctor. But no one's saying that the doctor is the authority.
Yes.
You and your doctor are working hand in hand in your primary care.
Yes.
Okay.
Yes.
Anything I missed?
No, I can't think of anything. Thank you so much for having me.
Yes. Okay, so I'm still not a bootleg doctor? No. She said no. No, stop.
You are the authority of yourself. Everyone is a bootleg doctor to themselves.
Yes, to themselves, not anybody else. She basically said, don't be doctoring on nobody. Amani, thank you so much for being here on Single Lady Chronicles. I want to have you back.
Thank
Okay,
you
when
so
you're
much.
in your residency, okay?
Yes.
All right. Thank y'all for tuning in to Single Lady Chronicles.
Yeah.
We're here every Friday night, 8 p.m. on Facebook Live. Make sure you like, share, subscribe, tell somebody, okay? Tell someone that if they don't have a primary care doctor, that they need to find a primary care doctor. You are your best advocate.
Yes.
And you need to make sure that you are here for a long life.
Yes.
Okay?
Yes.